So when we are doing the modified Rodnan skin scoring for the skin thickness, we basically have to, let the patient have comfortable loose clothes, and then you do the testing in two ways, right? So in two postures. First posture is having the patient sitting. So in that case, you do the testing for the face, you do the testing for the upper thorax, and you do the testing for the upper limbs. While when you have the patient while lying down position, you do the testing for the abdomen and the lower limbs. So whether it be any part of the body, whether it be the face, upper limb, lower limb, or the torso, we basically do testing in two manners. So this is what we do pinching, right? So in pinching, we are basically using our thumb and index finger and we are pinching the skin. The other type of test is folding. So here also we are, using the testing the skin thickening or the induration, but here we are using two thumbs and we are creating a fold on the area, whether it be the face, whether it be any particular site. Also remember, the interpretation or the analysis should be with respect to the induration more than the thickness, because the thickness is more of a subjective thing, while the induration is something that you feel. So what you feel is more important than the appearance, and also induration is more important than the thickness. Now coming to the scoring proper, we have 0, 1, 2 and 3 that we usually score. So whenever you're doing testing for the patient, whether it be thickness or whether you are pinching the skin, or you're creating a fold, you basically see induration and thickness, induration more than thickness. So here 0 means there is no thickness at all. Neither you're feeling any induration, neither you're feeling any thickness. That basically means that there is no, scleroderma in that patient. 1 means you are able to feel that induration and thickness, right? So here there are fine wrinkles that are visible, but at the same time you see that there is some thickness, or you get that feeling. Again, you're not focusing on the appearance, you are focusing on what you are feeling while doing the examination, and you should appreciate induration or thickness, but wrinkles are also visible. So that is when you give score 1. Now coming to score 2, in score 2 you see that there are no wrinkles. Here wrinkles have disappeared from the skin has become very, very smooth, right? So that is what happens in scleroderma, there is loss of wrinkles. Obviously there will be induration, there will be thickness, there will be whatever is seen in score 1, but in score 2 here you see that the wrinkles are absent as well. In score 3, you are not able to pinch. As you can see, this is how you can pinch the skin. This is normal, or this is also how you can create a fold. In MRSS score 3, you are not able to do this. You are not able to create a fold or not able to create a pinch, right? So this is how you score MRSS 0, 1, 2 and 3. Now there would be a confusion. For example, you are taking this whole forearm, right? So this is the anterior part, this is the dorsal part. Which part would you actually see, right? Suppose there would be one part where the score may be 0. There may be one part where the score may be 3. So what are you going to do? So there are 3 schools of thought here. One is that you do the global average. So you take the entirety of the body surface area in the sense that that particular part's surface area, and then you do a global average. That is, you divide that particular surface area into maybe 8 or 16 parts and you give scoring for each part, and then you take an average. That is what is global average. Then there is something called representative area. What is representative area? For example, this is the whole forearm. You take one particular area, for instance, dorsal part, middle, center of the forearm. That is a good representative area. There are standard representative areas, and whatever research you are doing, each particular research will have, a particular area which will be defined as a representative area. So that is representative area scoring. Obviously, you cannot take a weird area to be representative area, right? For example, if you're testing the face, you can't take something like, the jaw margin or something. There anyway, you will find the skin to be thick. So you have to take a proper representative area, something like a forehead, right? So these are standardized things which have been done in the previous researches, and those are usually